everyone, it's Elizabeth at Dr. Emer's office, and earlier today I was talking about Cosmelan and how much I love it, and now I'm going to talk to you guys about a different peel that I'm just as excited about. It's called Enlighten, and Enlighten has very similar actives to Cosmelan. It actually works very similarly. The reason why I like to recommend Enlighten over Cosmelan to some patients, such as this beautiful woman here, is because she doesn't have melasma, so she doesn't have that thick pigmentation. She has some photo aging and she has some little breakouts here, post-inflammatory hyperpigmentation. This is where Enlighten really shines. So similar active ingredients as Cosmelan, but it does have higher concentrations of salicylic acid, making it ideal for post-inflammatory hyperpigmentation and patients that are acne prone or breakout prone. So we're gonna start, it's gonna be a very similar application to Cosmelan. We start with our pre-exfoliating preparing solution, which is just medical grade acetone. This is gonna help remove any dirt or oil on the surface of the skin. So it's gonna be a little smelly, okay? Sorry about that. So this is all about exfoliating the skin and suppressing pigmentation. So we want to make sure that she has plenty of time to leave it on. I know it's really smelly, I'm sorry.
Okay.
So I'm just doing a quick pass right now with soft gauze. I want to make sure she has plenty of time to keep it on because she's going to be wearing this for about 10 hours. It's going to be similar to Cosmelan in that it's like a mask that we leave on, but this is gonna look more like pumpkin puree instead of peanut butter. So we just did one pass. Now I'm gonna do another pass and I'm gonna be a little bit more rough on the skin. I wanna produce a little bit of microcirculation with the degreasing solution or the preparation solution. And if you guys have any questions on Enlighten, please let me know. Okay, so I'm going to be a little bit more rough. I just want to make sure that I'm getting rid of as much dirt and oil in the way so that the peel is able to penetrate evenly. You okay?
Mm-hmm.
All right. So the Enlighten peel, like I said, it's really good for anyone that's struggling with post-inflammatory hyperpigmentation, anyone that's prone to breakouts, people that have pigmentation issues but not necessarily melasma. Remember, my go-to peel for melasma is always going to be Cosmelan. Always, always, always. Enlighten's also going to help with tone and texture. So, all right. You okay?
Mm-hmm.
All right. I'm going to apply a very thick layer. And Enlighten is made up of pigment suppressors such as kojic acid, azelaic acid, arbutin, licorice extract. It also has hydroquinone on it, in it. And this is what it looks like. You want to zoom in? It looks like pumpkin puree and it's going to stay on her skin for 10 hours. This is a Netflix and chill kind of evening for you. You're not going to be working out or doing anything that's going to generate any type of heat within the body. Definitely don't even want to eat spicy foods today. So no spicy Thai food today, I'm sorry.
To cancel my date altogether.
Sorry. Netflix has some really good documentaries right now, though.
They do.
Uh-huh. Okay, so I'm just going to apply a thin layer. I'm going to apply a thicker layer in the areas where she has the post-inflammatory hyperpigmentation and the breakouts as well. She has some red spots from past breakouts that have now dried up. Now this is also a really, really good treatment to maintain the Cosmelan results. So for people that are like, I don't want to do Cosmelan all the time, I want to switch it up. Enlighten is a great alternative to that. You're not going to peel as much. You definitely will peel though. You're going to be red. While the mask is on, you're not going to feel anything. It's when you go to remove it that you're going to feel some heat and some tingling. How is it feeling right now?
Great.
Yeah, when you have the mask on, it doesn't really feel like much. Do you have any questions, Courtney?
Not yet.
Okay. Enlighten's one of my favorites, and sometimes I like to combine it with dermaplaning just to make it a little bit more aggressive, but of course the downtime is a little bit more. Dermaplaning helps to get rid of any dirt and oil and dead skin. So I like to do that a little bit, and then I'll apply Enlighten. A lot of our patients love that because they do get pretty good results by doing that. Let's see. So we're using pigment suppressors and high concentrations of salicylic acid. So for any of you that are struggling with post-inflammatory hyperpigmentation and you still break out, I highly recommend doing Enlighten because of the high concentrations of salicylic acid. It's definitely able to help with any breakouts as well. Now, her home care is going to include hydroquinone and retinol. And we need to continue to use hydroquinone because it's going to help to suppress the pigmentation as well. So for all of you guys that have pigment issues, it's not enough for you to come and see us for a peel once in a while. You really have to be committed to using the right home care. And hydroquinone is something that you have to continuously use. We recommend using it for a few months on, and then you can start using other pigment lighteners, such as my favorite, which is Phyto Plus. I love that stuff. It's called Green Gold for me. It has high concentrations of kojic acid, so it's really nice in lightening and brightening the skin, and also it helps with pigment suppress. It's a pigment suppressor.
So why doesn't this go on the neck too?
We can definitely do it on the neck as well. Do you want it on the neck? I don't think you need it on your neck. I mean, I can bring it down a little bit.
I was just wondering if it does the same thing to the neck that it does to the
Absolutely. It'll do the same thing. The only thing is that we would leave it on less time on tissue because the neck is the skin is a little bit thinner. So we'd leave it on a little bit. You definitely don't want to do this to your entire body all at once. We like to do a couple of sections at a time. So we could definitely do your neck and your face, but then your décolleté would have to be done at a later time. So right now I'm just making sure that I have it everywhere that it needs to go, and I'm not going to bring it up too close to the eye area.
Someone asked, how long is the downtime?
You're going to be red for a few days. There will be light peeling, mild peeling for about 7 days with Enlighten.
What does it feel like when it's applied?
What does it feel like?
It feels good. It feels refreshing. It feels like someone's painting on some ice cream on your face. If you've ever put on like a mud mask yourself, that's what it feels like. Now, when it starts to peel, am I supposed to let it peel on its own, or am I supposed to help the peeling come off?
That's a great question. So for all of you that have never gotten it peeled before, if you're peeling, please, please, please do not peel at the skin. Do not cut it. Do not pick at it with tweezers or anything at all. You're supposed to let it just fall off. Last week I don't.
I don't.
You don't?
No.
I didn't hear that. I didn't hear that. No, you're not supposed to. That could lead to more pigmentation. Yeah. Last week I did the Rev peel on myself, and I was talking to my husband, and he's like, it looks like you have a beard of dead skin when you're talking to me. And so you want to use Cleanzyme and Skinzyme. Those are the two actives that we use. Cleanzyme and Skinzyme use papaya enzymes to eat away at dead skin. So they're awesome. You want to let that exfoliate your skin instead of picking at it. All right, so our patient is going to go home and remove this lovely peel in 10 hours. She will feel hot when she removes it. Her skin will be red. It'll be sensitive for a couple of days, and then she will start peeling around day 3. Any other questions? All right, thanks for watching, guys.